Hello, everybody. So I hope you and your family are safe, stay safe. And so today we talk about the insomnia and sleep disorders. So something again, why I choose this topic because more and more people get sleep issue, especially right now it's pandemic. So a lot of people get stressed and then they cannot sleep very well at night. But however, stress is not the only reason to cause insomnia or sleep disorders. So today I will talk about the disorder, and I will talk about the definition of insomnia and sleep disorders, and why sleep is so important for the body. What's the difference between the sleep at night and sleep in the day? We sleep in the day. Okay, so the reason, what cause insomnia and sleep disorders. So same thing when we treat a patient, when we treat any kind of disorder, any kind of disease, we have to know the reason. We have to know the root, the cause. So why cause that problems? Then we can treat the cause instead of only treat the symptoms, right? So if you have insomnia or sleep disorders, so you don't just take a melatonin, okay, resolve everything. No. So that's why so many people come to my office, tell me, okay, I take 2 or 3 melatonin every single night before I go to sleep, but still I cannot go to sleep. Or if I can go to sleep, I cannot stay sleep. Sleep. So I wake up very, very easy. So it's all these things. So that's because we didn't find the cause. We only treat the symptoms, right? Okay. So the first definition. So definition of insomnia and sleep disorders. Actually, insomnia is one of the sleep disorders. So insomnia means the trouble falling and staying asleep, right? So some people get sleepy easily, but however, they wake up so often, so frequent. So they definitely affect the sleep quality. Okay, so sleep has a short term and a long term. So that means short term is acute insomnia, and the long term is a chronic insomnia. So the insomnia is not constant. It can come and goes, can off and on. So it depends the reason, depends what you can get from the outside, the body or the surrounding around you. Okay. So acute insomnia lasts about from one night to a few weeks. It can go to 1 night for a few weeks. And a chronic one, when it happens, so at least 3 nights or a week or 3 months or more. So why we talk about acute and a chronic insomnia, because once you get a chronic insomnia, you have to be careful because insomnia causes a lot of problems. So that means the sleep can cause a lot of problems. So that's why I will talk about later on why sleep is so important, right? So before we get to the why sleep is so important, we will talk about a little bit insomnia, the type of insomnia, 2 types of insomnia. So the first one is the primary insomnia. Primary insomnia, that means this insomnia is not linked to any other health condition or problems. Okay. And second insomnia, so that means you have some trouble sleep as because your health conditions like asthma, depression, or cancer, heartburn, the pain, or some medication, antidepressant medication, or substance use like alcohol, even sugar. So later on I will tell you why sugar causes problems, right? You see, there's so many. Actually, secondary insomnia is much more often than the primary. So that's why we have to find a reason. If you have asthma, we have to treat asthma. If you have depression, we have to treat your depression. If you have arthritis, we have to relieve arthritis pain. If you have cancer, we have to balance your body to let your body get stronger to fight or to get along the cancer cell, right? If you have heartburn, we had to figure out why you get a heartburn, and maybe the stomach, maybe esophagus, maybe the large intestine, small intestine, all the digestive system. So we had to make sure we find out the reason, then we treat the cause. That's the only way we can resolve the issue, right? Not only insomnia. The area of my lecture, I'll talk about that. We had to find the cause. That's why so many people went to medical doctors and said, okay, I don't feel difference since I've been there for a long time for some. So that's why they don't think about the cause. They don't treat the symptoms, right? Same thing with this pandemic, the virus or bacteria. So if you have the best way is to build up immunity to let our body fight instead of just waiting there or to treat, right? Okay, so now we talk about the importance of the sleep, right? So you have to know why it is so important. Then you can aware how important that you can aware why I chose this topic, why you had to get treated for the insomnia or sleep disorder. Okay, so sleep affects emotions and social interactions. Okay, so sleep loss reduces your ability to interact socially. Right? If you don't sleep very well, and then you don't have enough ability to interact with people, the people has to social with other people, to communicate with other people, to get things done. So several studies have confirmed this using emotional facial recognition test, actually. So one study found that the people who had not slept had a reduced ability to recognize expressions of anger and happiness. So they were confused about the impressions and anger and happiness. So they lose ability, they reduce ability at least. So and also a lot of research believe that poor sleep affects your ability to recognize important social cues and process emotional information. Right? That's why if you don't sleep very well, you maybe you will become grouchy, you will become angry easy, you become it's not very energized, not very motivated. All this kind of emotion change can happen after that. Okay, so poor sleep is also linked to the increased inflammation. So interesting, right? And it's together, sleep improves your immune function. So sleep can have a very, very big effect on inflammation in the body. So actually the sleep loss is known to active and undesirable markers of inflammation on the cell's damage, right? So that means if you don't sleep very well, it's easy to get inflammation and cells damage. So if you have cells damages, that means it can cause a lot of organ function problems. So personally, that's why a lot of people, they don't sleep very well, then generally they do not have a very good digestive system. Okay, poor sleep also being strongly related to long-term inflammation of the digestive tract, right? For example, is IBS, which is inflammatory bowel disease. So this is a very, very important major reason to cause the IBS. So the other study observed the sleep, the study observed the people who have very less sleep. So with the Crohn's disease, they were twice as likely to relapse as the patients who sleep well. So that means if you don't sleep very well, you get a 2 times chance to get a Crohn's disease. So Crohn's disease is a very bad digestion disease. They can cause a lot of can cause asthma or can trigger the bleeding in the gut. So this kind of issue. And also research are even recommending the sleep evaluation to help predict the outcomes in individuals with long-term inflammation issues, right? Okay, so the other one is the sleep can improve your immune function. Even a small less sleep has been shown or impair your immune function. That's why if you have 3 days or 4 days night in a row you don't sleep very well, you easily get an allergy. You easily get a cold. Actually, allergy is your immunity problems. A lot of people say, okay, I have allergy. No matter it's food allergy, no matter it's the pollen allergy, no matter it's the hair allergy, or dog hair or cat hair, it's all because immunity is so low and you cannot control, you cannot manage the particles from outside the body, then your immunity get a reaction. So only, this one large 2-week study monitored the development of the common cold after giving people nasal drops with the cold virus. Okay, so they found that those who slept less than 7 hours were almost 3 times more likely to develop a cold than those who slept over 8 hours or more. So when we talk about the 7 hours or 8 hours, so it depends on people. It depends this picture you can tell it's also talk about 7 hours here. So it depends, the people, depends the age, depends the gender. So some people sleep 6 hours still okay as you get a deep sleep, but some people get 8 hours, even 9 hours. However, you don't get a very deep sleep. You very shallow sleep. It's still not good. So it's still your body still cannot heal. Your body only can heal from the deep sleep. Okay, right. So poor sleep is linked to depression. So that means if you don't have regular sleep, you're very easy to get depression. So mental health issues such as depression and they are strongly linked to the poor sleep quality and sleep disorders. So it has been estimated that 90% of people with depression complain about the sleep quality. It's pretty big. It's pretty big amount of people. So it has been, as research that too. So poor sleep is even associated with an increased risk of death by suicide. It's dangerous. So those who is sleep disorders like insomnia or obstructive sleep apnea, so also report significantly higher rates of depression than those without. Okay, so poor sleep can cause a lot of emotion issue, can cause a lot of bad result. Okay, be very careful about that. All right. And the sleep also affect the glucose metabolism, and also same thing, they can affect your the diabetes. If you don't sleep very well, it definitely can cause you get a more chance for diabetes, right? So experimental sleep restrictions affect blood sugar and reduces insulin sensitivity. So that means if you have better sleep, your insulin level cannot get enough to digest your sugar. So that means cause insulin resistance, then cause diabetes, right? And also vice versa, if you have diabetes, if you have poor sleep, and also that can also make diabetes worse. So for example, I always tell the patient, especially diabetes patient, when before go to bed, try to take a piece of protein, then to balance the sugar, and then to go for the sleep. A lot of people actually, especially for diabetes patient, they wake up because they're low sugar actually. Okay, so they have to be very careful. When we talk about in the meeting, we talk about on the radio too. Okay, so this in a study, there's a study shows that in healthy young men, restricting sleep of 2 to 4 hours per night for 6 nights in a row, they cause symptoms of prediabetes. Interesting, right? So these symptoms resolved after after 1 week of increased sleep duration. So the poor sleep habits are also strongly linked to adverse effect on blood sugar in the general population. Okay, so this sleeping less than 6 hours per night have rapidly been shown to be at an increased risk of type 2 diabetes. Okay. Next one, so poor sleepers have a greater risk, is much greater risk of heart disease and stroke. So very interesting. So sleep quality and duration can have a major effect on many health risk factors. So there are factors believed to drive chronic disease, including heart disease, and also a review of 15 studies found that people who do not get enough sleep are at far great risk of heart disease or stroke than those who have sleep 7 to 8 hours per night. So again, 7 to 8 hours per night only depends on people. As long as you get a good amount of 5 to 6 hours deep sleep, you're good. So okay, good sleep can also maximize the athletic performance. Okay, if you are athlete or half professional or even professional athlete, whatever, so you have to be careful. You have to have very good sleep. So sleep has been shown to enhance their performance or their athletic performance. So in a study, and it shows on the basketball players, so longer sleep will show to significantly so improve the speed, accuracy, reaction times, and mental well-being. Okay, if you have less sleep duration has been associated with a poor exercise performance and a functional limitation in older women. All right, so studying over 2,800 women found that poor sleep was linked to a slower walking, lower grip strength, and a greater difficulty performing independent activities. Quite interesting. Okay, so next, so good sleep also can improve concentration and productivity. So sleep is very important for various various aspects of the brain function. So this includes the cognition, connection, and the concentration, productivity, and performance. So all of these are negatively affected by sleep deprivation. Okay. A study on the medical interns provides a good example. Okay, interns on traditional schedule with extended work hours of more than 24 hours made 36% more serious medical errors than the interns on a schedule that allowed more sleep. Okay, so as a health practitioner, you have to make sure you have good sleep too, right? So another study found that short sleep can negatively impact some aspects of the brain function to similar degrees as alcohol intoxication, right? So on the other hand, the people who get a good sleep has been shown that to improve problem-solving skills and enhance the memory performance of both children and adults, right? That's why we talk about. So the poor sleep, last one, poor sleep can relate to a dementia. So I do have patients come here, they definitely have memory loss. They were diagnosed by neurologist dementia. So when I talk about when I ask a history to evaluate the patient, definitely your patient's husband told me actually, he said she didn't sleep very well at night, or keep up easy every hour, go to the bathroom. He's very grouchy at the day. So that means she didn't sleep very well for 4 years, and then memory got short memory loss, pretty bad. Okay, poor sleep is also linked to higher body weight. So that means if you don't get regular sleep, so you gain weight easily. You gain weight easily. Okay. All right. So the same thing. The good sleepers also can eat. They can burn more calories. So studies show that sleep deprived individuals have a bigger appetite and tend to eat more calories. Right? Sleep deprivation. So this disrupts the delay fluctuations in appetite hormones and is believed to cause poor appetite regulation. So this includes higher levels of ghrelin, the hormone that stimulates appetite, and reduced levels of the leptin. Leptin is the hormone suppresses the appetite. Okay. So same thing, the person with the high body weight. So the person is strongly linked to the weight gain. The people with a short sleep duration tend to weigh significantly more than those who get adequate sleep. So actually, in fact, the short sleep duration is one of the strongest risk factors for obesity. So there, in one extensive review study, children and adults with short sleep duration were 89% and 55% more likely to develop the obesity, respectively. Okay, so the effect of sleep on weight gain is believed to be mediated by numerous factors, including hormones and motivation to exercise. If you are trying to lose weight, so get a quality sleep is absolutely crucial. That's why we talk about it later on. So cortisol level play a very important role in adjusting your sleep. Okay, adjusting your sleep. Okay, the reason for the insomnia for sleep disorders. So there's a few different reasons cause the problems. You will talk about the primary and secondary. So the primary insomnia reason cause that is, for example, include stress related. So for example, the big life events, the job loss, change, the death in the family, divorce, and moving. So things around you like noise or lights or temperature. So that's later on we talk about the tips for you to sleep better. So that means I will talk about that, more specifically. So the temperature, how low the temperature you want to get in your room. You don't want to get too high, you want to get too cold. So you want to get about 70, the lower 70 area. Okay. All right. To changes to your sleep schedule, like the jet lag or the new shift at the work or bad habits you picked up when you had another sleep issue, another sleep problems. Okay. Others cause of secondary insomnia include mental health issues like the depression, anxiety, the mental issues, but they affect each other. If you have mental issue, depression, you have better sleep quality. This is a better cycle. So we have to make sure, we fix that, we break the cycle and making the body function better. So medications for colds, allergies, depression, high blood pressure, and asthma. These all medications can cause that problem too. Pain or discomfort at night, it can cause the insomnia. So that's why we had to find the cause. Why have the pain? Why have discomfort, right? So caffeine, tobacco, or alcohol use, even the sugar use, because the sugar and alcohol can raise your body temperature and then let you have a hard time to get sleep and affect your sleep schedule. Thyroid. So thyroid issue, hyperthyroidism issue, and other endocrine problems can cause a problem to menopause or the hormone is imbalance. All these hormone related issues, they can cause insomnia too. That's why we have to fix this kind of hormone issue before we fix the sleep, right? Sleep pattern. So other sleep disorders, like the sleep apnea or restless leg syndrome, this all the other, the sleep disorders. So it can cause us sleep insomnia too. All right. So we talk about, this sleep disorders. We talk about sleep apnea. Sleep apnea is very strong related to your TMJ joint and the upper cervical. So TMJ joint is a very funny joint. It's on is your jaw. Is your jaw as when you open the mouth and the air can feel the jaw moving. So this joint can affect a lot of the spine issues, affect a lot of health issue. I have few cases of teenagers because the TMJ is pretty off. They cause scoliosis, and then I have so many sleep apnea patients also because they have the teeth issue, have TMJ issues. So upper cervical, temporal bone and TMJ joint these three things affect each other. So when you treat the patient like a sleep apnea or TMJ problems, you have to treat these three locations. Okay. So restless syndrome is also another sleep disorder. So you cannot sleep very well at night because you have this kind of neuropathy issues and restless leg syndrome. We have treated the cause. We have treated the restless leg and sleep apnea first, then to fix the insomnia. All right. All right. So we talk about the reason, we talk about the definition, we talk about the types of insomnia, we talk about the importance of the sleep, and now just now we talk about what's the cause in their insomnia, cannot sleep very well. So then we talk about the approach, right? So the approach to insomnia and sleep disorder. Again, so when we try to find the approach to treat your the insomnia, we had to find the reason, the root. So just like the tree, symptoms all in the tree, you can tell the problem in the root is the causes, right? The cause. So we have to use a health triangle with the structural, with the emotional, with the diet. So to approach the sleep disorder. So sleep disorders, the insomnia is not only, you don't sleep well, you take melatonin. So melatonin definitely is very important because, that's why a lot of people, you have to know why your body cannot produce enough melatonin to let your own body use that, and then to make a better sleep, then you can heal faster, you can improve your immunity, right? So triangles, these affect each other, same thing structurally. If you don't have very good spine, all the nerve coming out of spine goes to every organ. If you don't have a healthy spine, your nerve flow is not very good. They cannot move. They cannot innervate the organ function that's supposed to, and then your body gets sick, right? So same thing in nutrition. If you don't have very good diet, and then your body you don't have very good nutrition support, your organ function in the nutrition, right? And also same thing, if you don't eat very well, hungry, angry is always right? If you don't eat very well, and then you get very angry, it's not very emotional. So after you eat, you feel better. And also the research, if you eat a very good meal, your body can release a lot of hormone, the heavy hormone or the positive hormone chemicals to heal the body better. Okay. About the acupuncture, how Chinese medicine acupuncture approach to the insomnia, right? So acupuncture, the mind, the heart, the heart control the mind. Is not in Chinese medicine. They think the heart control the brain. It's not brain control the heart. So the research, just like I told in the radio, there's a 1,000 times energy. 1,000 times energy around the heart and then on the brain. So that means when we do acupuncture, we have to make sure we use some needles on the the pericardium function, the heart function, improve that. And also there's a liner. Pericardium is the liner of the heart. So if you actually they did a research, a lot of palpitation, chest pressure, they don't sleep very well at night. It's all because you have a pericardium problems. That means the liner problems. Instead, you have the real heart problems. That's why a lot of people don't sleep very well. They have palpitation. You have chest pressure. They just try to check their. They do their stress test. They do their cardio echo. They did the EKG. Nothing show up. Right? So that's only it just means you don't have a pathological change, you have functional change. That's also we talk about the body signals and the warning signs, right? It's a signal to tell you something going on there. You have to be very careful, right? So also heart rate in Chinese medicine, heart is coupled to small intestine, so your digestion play a very important role to contribute to your insomnia or some to be sleep issue too, right? So we talked about before. So when I have a patient come here, complaint about the insomnia, complaint the heart issue. So when I ask the patient history, I say, okay, how's your gut? The patient just like surprised why you asked me that, because I said because from Chinese medicine they relate to each other. The patient actually said, okay, since I remember something, I was 5, so I never have a good gut because the time everything is around antibiotics, So everything is I get a little bit sick, the allergy, antibiotics, the cold antibiotics, everything antibiotics, it damaged my gut, since I'm 5. So it's been very, very sad. So I treat the patient, the same thing. The patient went to a cardiologist, went to the PCP, went to, the family doctor. They didn't find anything different. So, that's the only thing, they may actually, but they don't know. From Chinese medicine has different angle from acupuncture standpoint. Same thing. Acupuncture have different angle to see the patient. That's why a lot of people want to see me in the office, because I'm holding 2 licenses. One is a chiropractic license, one is a chiropractic license, one is an acupuncture license. I got all my education, Chinese medicine education from China. So I have 2 degrees in China, for Chinese medicine and acupuncture. So I know how the body work together, how the body I work as a whole instead of as part, right? Okay, so same thing in Chinese medicine. We use the needles to increase the heart function, the small intestine function. Then after that, we increase the sleep the quality. So same thing, just like you, as always. I always give the patient some tips. They can bring to home. They can tell their friends who had a sleep issue about these tips. It helps a lot. Same thing. You should be your doctor. You cannot rely on anybody else. You cannot rely on any practitioner, any doctors. You have to control your health. So, and also all the treatment in the office or from the other side is not enough. You need delay exercise, delay maintenance, your health. Okay, delay. All right. So tips. So you had to go to sleep. Before 11 p.m. each night. So this one comes from Chinese medicine, because Chinese medicine based on Chinese philosophy, based upon the 5 elements, based upon yin and yang. Yin means night, yang is day. So before midnight is about 12 o'clock. Before midnight is yin, right? After midnight, so yang start to back and yin start go down. So if you have hard time to sleep before 12, and then your yin and yang not balanced. when your yin and yang not balanced in Chinese medicine, and can show as a long term, and your hormone will not balance, right? All these things relate to each other. That's why so many people, especially at night shift people, their yin and yang not balanced, actually have very bad health. They don't have very good health actually. So this patient, I will talk about the patient just now, and that patient has been doing that night shift for about 5 years. Okay, it's a lot of problems. The cholesterol issue, and the blood pressure issue. All these kind of things issue after 5 years night shift is show up. Okay. So don't use phones or ebooks before bed. So when I say phones or ebooks, that means the iPad, the screens, the laptop, the TVs, because it really, not only because it stimulates your brain, but also because they release a lot of blue lights. So blue lights can wake up your brain, so let your brain get more active, right? That's why a lot of people have ADHD. That's one of some reason cause ADHD, and because the blue light. I told the parents, the blue light is abused. Blue light is bad enough to let a patient have emotion problems. Okay, so you have to avoid caffeine, sugar, nicotine, alcohol in the diet. Right, so it means sugar, alcohol. We talked about before. Sugar, alcohol actually increase the body temperature, and then to let us sleep less. Let your hard time go to sleep too, and also even go to sleep, you do not get a very deep sleep. Okay, so I know a lot of people like to work out, do their exercise, before go to bed. It's about 4 hours, about 4 hours. So about 1 hour, 4 hours, before go to bed. So which is wrong because the body is too excited. So at night, it's the same thing again in Chinese medicine. At night, yin, you should be relaxed. You should be the body go in. Yang means active, yin means inactive. Usually your body should be relaxed there, you should be enjoying the peace there. So instead I'll do the exercise, okay? And also a lot of researchers did research too. They recommend you do exercise at least 2 hours before bed. 2 hours before bed, okay? So bedrooms. So we talk bedroom. We talk about melatonin. So melatonin is produced by the pineal gland, which is in the brain, right? It is produced in a very dark environment. So that's why if you sleep in the very bright the room, and your melatonin cannot produce in a white brighter room, you have a hard time to go to bed. So that's why I recommend people, you have to make sure you have a very quiet environment, and then the degrees in your room should be below 70, around 70, but not too cold. It's below 70, but 65 to 70 is all good degrees. Okay, and also same thing. I did recommend you guys either leave a protein snack instead of sugar snack. Okay, so people go to bed. So again, so also plus, by the way, I do not recommend people eat fruit before go to bed because the fruit has too much sugar, and your body is very hard time to balance sugar at night. Instead, even though you're healthy, right? So it's very hard time to balance the sugar. So be careful that one too. All right. Okay. So next. Okay. So last but not least, so same keep healthy, do no harm. So you always want to build up your body instead of treat the problems. And also thank you for listening. If you have any questions, just reach out to my office, to call my office. You can go to the website, Roselle Center, rosellecare.com. My email is there. You can call. Phone number is there too. You can call front desk. Have a question, I can call you back. If you have any question, you can email me too. Okay, but don't go away. Have something to do too. Okay, so same thing. We do this for the reason too. We do we our office have have charities. It's charities but care for others. So our boss Dr. Roselle been doing this for years. So if you want to sit down with me to talk about your health, talk about insomnia, talk about any kind of health issues, do evaluation, with the chiropractic evaluation and consultation, or acupuncture, and because same thing, I can do both. I have 2 licenses, and you do acupuncture evaluation with me. So you just we charge $99, available only from this lecture. That means when you call the office, you schedule me, you have to tell them I'm from lecture, right? They can give you the promotion. So this $99, we don't go anywhere, just go to care for anyone else other than that, the care for others, which is the charity's tax deductible. And so if you have any question, let me know. I'm always here to help. My philosophy is, I'm here to educate people. I'm here to help people. I'm here to make your life better. I'm here to make your where you can control your health. Okay. All right. Take care. Stay safe. Bye.